The Autoimmune Association is the world's leading nonprofit organization dedicated to autoimmune awareness, advocacy, education, and research. Autoimmune diseases affect over 50 million people in the U.S. alone. These are serious and costly chronic conditions that can have a lifetime of impact, both physical and psychological. Many people living with autoimmune diseases don't get the benefit of an early diagnosis or treatments that work well for them, simply because the research hasn't caught up yet. While we don't know exactly how much autoimmune diseases cost overall, some estimates are over $180 billion for just 29 conditions. But what we do know is every person living with an autoimmune disease carries not only a financial burden, but also an emotional one. And as more people get diagnosed, the burden continues to grow. When we invest in research, we can find these diseases sooner, improve treatments and outcomes, and lower the long-term cost of care. Most importantly, for people who are suffering, research brings hope, the hope of getting back to the life that they had before they got sick. Federally funded research has led to major breakthroughs in treating conditions like rheumatoid arthritis, lupus, multiple sclerosis, and Crohn's disease. These discoveries don't just save lives, they help stop diseases from getting worse and can lower the overall cost of care. When we invest in autoimmune disease research, we get better tools to diagnose early, treat more effectively, and help people live healthier, fuller lives. It's not only essential for public health, it's also a smart investment. Every dollar invested in NIH research generates $2.56 in economic activity. So you see, research truly pays off for patients, families, and for our entire country. Let's look at what it takes to turn science into solutions. Every breakthrough in autoimmune disease starts with a question that is sometimes sparked by a patient's unexplained symptoms or a doctor's curiosity. Turning that question into a treatment takes years of research along with the dedication of scientists, the courage of patients, and the support of a committed community. A lot of people think that all research happens right on the NIH campus, but actually about 80% of research takes place elsewhere, in universities, hospitals, community clinics, and all across the country, not just Rockville, Maryland. The NIH is considered the gold standard in research, the crown jewel that supports over 2,500 research institutions in nearly every congressional district across the country. This wide reach means discoveries aren't limited to just a few elite research centers. It is truly a national effort that involves communities everywhere. But science doesn't just happen in isolation. A breakthrough in one area often leads to progress in another, sometimes in ways no one could have predicted. For example, you've probably seen TV ads for Dupixent, a treatment for eczema. That medication became possible because researchers first studied how certain immune cells and signals work. Research that started in fields like immunology and transplant science. A lot of techniques developed to target cancer cells, like monoclonal antibodies and immune checkpoint inhibitors, also paved the way for today's biologic treatments that help people with psoriasis. The process is demanding and rigorous. This is not a short or easy journey. So here's an overview of how it works. It starts with a proposal. Then comes peer review. Every proposal goes through this rigorous assessment by a panel of experts who evaluate its scientific merit, innovation, and potential impact. It's highly competitive and is designed to make sure public funds are well spent. In fact, only about 1 in 5 proposals get funded. Sometimes the success rate is even lower, 10 to 20%. That means a lot of promising research never gets off the ground, not because it lacks value, but because we just don't have the money. Scientific progress depends not only on discoveries, but on the people behind them. It can take 15 to 20 years to train and develop an independent researcher, and that journey needs steady support along the way. Most scientists don't choose this path for personal gain. They do it because they deeply believe in the power of science to improve lives. That sense of purpose is what drives the entire effort forward. Once discoveries are made, they don't just stay stuck in the lab. They're shared with everyone. That is when science really takes off. When researchers around the world build on each other's work, every new insight and idea can inspire another, creating a ripple effect that speeds up progress and drives innovation forward. And when science moves from the lab to the bedside, discoveries become hope. They turn into treatments that heal, tests that guide care, new standards that improve care for everyone, and therapies that can help people reclaim their lives. And it's important to note that it's not just scientists shaping the future of research, it's all of us, patients, caregivers, advocacy organizations. Public health is personal, and the science we fund should reflect the needs and voices of the people it's meant to serve. Each year, the Autoimmune Association hosts an advocacy fly-in where patients travel from across the country to share their stories. Last year, we interviewed a young woman whose life had completely changed between ages 21 and 25. She went from vibrant and active to essentially bedridden and nearly hopeless. She told us she had even considered taking her life. But then she met a doctor at NIH, someone who listened, believed her, and pieced together the mystery of her illness. She enrolled in a clinical trial. Thanks to that care and the research behind it, her life has been transformed. She now has hope. She called that doctor her angel. Remember, research changes lives, and that is what makes the NIH possible.